For the next speaker, as we know, he is the director of the HIFU, and now we move from the surgery to the non-invasive or no invasive procedure that we can use it for the treat the patient with the endometriosis. Professor Zhang Lian will talk about the comparison of the ultrasound-guided HIFU for treatment the abdominal endometriosis. So he is the director of the Chongqing Haifu Hospital. He is the president of International Society of the MISIF Society of Minimal Invasive and Virtual Surgery, and he is the chief editor board member of International Journal of Hyperthermia, and of course he has a lot of the publication about the HIFU. So please, Professor Zhang Lian, over to you.
Thank you.
Can you share the screen?
Yes, I'm doing.
Okay.
So thank you, Olarik. It's really my honor to have this chance to give this presentation, especially, we meet our friends. So this I'm going to talk about the comparison of HIFU and the surgery for abdominal wall endometriosis. So we all know that abdominal wall endometriosis is a real form of extrapelvic endometriosis. So, but in China, because we all know that we have a very high incidence of cesarean section, so we saw not a real. Yeah, in China we saw many patients in recent years. So the symptom of this disease is a local pain at the cesarean scar incision site of abdominal wall during menstruation. So this is the most common symptom. So the treatment, so far, is still the surgery is the only curative therapy. However, the surgery is invasive, or also will cause scars, and also the surgery will perform under anesthesia. So if we can find another way to treat this kind of disease, so we think about to use this technique to use HIFU to treat this patient, because this is non-invasive, and the maybe because the disease, the abdominal wall endometriosis is very superficial, so it's very sensitive. So far, still, I think I should talk about this technique, like the high intensity focus ultrasound is a non-invasive treatment modality. This is a transducer. The ultrasound beams penetrate the generate from the surface of the transducer and focus at a very small point at some distance away from the transducer. During the treatment, the ultrasound beams focused at the target. When the temperature increased over 65 degrees, the necrosis occurred at the lesion, and we can saw the graphical changes on the monitoring ultrasound like this. So when we saw the graphical changes like this, the necrosis already occurred, because like we already see some gas in there, like just the water is boiling, some oxygen come out. So it means when we saw the graphical changes like this, they always for sure the necrosis occurred. So this technique has been used to treat a different type of solid tumors, like the uterine fibroids and also adenomyosis, also breast cancer, breast fibroadenoma, also liver tumors, pancreatic cancers, and also kidney tumors, also the bone tumors, and like even primary or bone metastasis, also uses to treat the soft tissues and also some others. For adenomyosis, I think this is a new indication. Like I just said before, because this lesion is always superficial, so it's sensitive to HIFU. But when we treat this lesion, because this treatment is under conscious sedation, so the patients is awake. So when we treat these patients, because the skin, the lesion is located in this area, so the patient will feel pain. So this most important, if we use a conscious sedation, how deep? And we must discuss with the anesthesiologist to make sure it's to use the right degree of the conscious sedation to sedative to make the patient sedative and more tolerated treatment. So because it's very superficial, the treatment, when the power we used not so high, like we use it to the power to treat uterine fibroids or liver tumor, we always use 400 watts. But for the abdominal wall endometriosis, we don't need to use so high power, and probably 200 watts it's enough based on my experience, because like we use 200 watts, we can easily to see the graceful changes like this. So the only thing we should think about is that just because the treatment is under conscious sedation, usually the patient will feel the pain. So we should just give enough energy to make sure to complete ablate the lesion. Otherwise, maybe we'll cause a higher recurrence rate in the future. So that's very important. But like Chyi-Long said, the training is very important also for HIFU, especially for abdominal wall endometriosis. The training is very important. So the principle of HIFU treatment for abdominal wall endometriosis is the same way, just like we treat the adenomyosis, the simple. We still like just selective ablate the lesion and minimize the size of the lesion and cause the symptom improve the symptom. For example, we saw that, and during treatment, we just like this, then this precisely and ablate the lesion to make the lesion shrink in the future and improve the symptoms. So like here is the MRI image we obtained from patients, and I can show you because it's different from surgery. If we perform surgery, just like the Apdora, for example, and then we can perform the surgical resection, remove the abdominal wall endometriosis. So, but for HIFU, it's a non-invasive. Then we can use MRI image to evaluate the treatment results. For example, like this, before HIFU treatment, we can see the lesion over here. Then one day after that, we can see there was low enhancement compared with this one. So 6 months, the patient came back, then we performed the MRI again. We can see the lesion was much smaller compared with this one day after that. And also there was low enhancement in the treated region and low recurrences. So like this, if we performed, give enough power and treatment range was just right, then we can still use this way to make the curative treatment for abdominal wall endometriosis. So here, like this study is just from the Beijing, the PLA General Hospital, Dr. Wang, he performed this kind of treatment. This is the first preliminary study. So from 2007 to 2009, and 21 consecutive patients with abdominal wall endometriosis were enrolled. So you can see from this table, then the power they used from 200 watts to 400 watts. This kind of like the power they used a kind of high. So the treatment time you can see very short. The room time like just the treatment time just 13 minutes. So from 5 minutes to 48 minutes. So that's a range. So median solution time. So because they used the higher power, so solution time just like the median solution time just 84 seconds. The range just from 32 to 650 seconds. So kind of short. So it's very, we still can, from this table, we can say it's easy to ablate the lesion of abdominal wall endometriosis. So about the safety. So because like I said, it's very superficial. It's if you say overtreated the lesion may cause a skin burn. So and also use a higher power, then you should be very careful. So like this study, Dr. Wang, his group, their results showed no skin burn was occurred in this study. The 21 patients, no skin burn occurred. All patients were discharged after a short observation. So during the treatment, the patient, they say the pain score is lower than 4 points. The tolerance was very good. So then the follow-up result, they show the pain didn't recur during a mean follow-up of 18.7 months. So range is 3 to 31 months. So this 21 cases had good results. So also the image showed the lesion after the treatment gradually shrank over time. So this is the image from this paper. You can see this before, just like similar to the image I showed before. So we can see the contrast enhancement was obviously the blood supply was rich in this lesion. So here, 2 months after that, we can see the treated region was getting smaller. There was low enhancement. Okay, here is the pre-HIFU treatment, the ultrasound. Here immediately after that, we can see the color Doppler showed the blood signal. Then after that, there was low blood signal on the color Doppler. So then here is another study after the preliminary study. So the other group in China, they performed the treatment like this is from Sweden Central Hospital of Sichuan Province. From 2010 to 2014, they treated 32 patients with abdominal wall endometriosis. So this is a retrospective study. Their results show this treatment parameters like the solution power, they just used 100 watts, so much lower than Dr. Wang from Beijing they used. So you can see the solution time. They spent like the 200, the median solution time just 200 watts. So it's double than Dr. Wang's treatment results. So the room time was longer than Dr. Wang's study. So the total treatment time and also like the lung perfused volume ratio, it was good from this study, even they use a lower power. So about the safety, also they evaluate the adverse effects. So like this, most of the patient they used the like the classification from the International Society of Interventional Radiology. So like most of them were classified as class A. So 100% of the patient have the pain during the treatment, but all of them complete the treatment, then they saw the edema of the skin in the treatment area after the treatment, like 78% of the patient had edema in the local skin, but no other major adverse effects occurred. So low skin burn occurred, still safe in their study. So also about the volume of the lesion, they changed this. Here is pre-treatment, and 6 months after this was significant decreased. And the pain score before treatment was 6.8 points. 6 months after that, the average point score was 1.8, significant decreased. So, and this study from Sweden was just like the short-term evaluation. So here is another study, is a midterm evaluation. This study was from Beijing. And Dr. Duan Hua, I think maybe you guys knew about her. So her team did this study from March 2014 to June 2016. And they enrolled these patients, 25 cases in this study. This is about the follow-up results, like this, the score, the pain score that's before, and here 6 months is 12 months and 2 years. So from this study, like the pain score, like 1 month, this table, they didn't show the pain score before, but 1 month was significant decreased. So 6 months after that, the pain score was kind of comparable with the study from the Sweden, but 2 years, the pain disappeared. Actually, so it's very interesting. The pain score, the symptoms improved over time, but not all of them, like the pain relieved, but not disappeared right after the treatment. So here is about a shrinkage, the volume shrinkage. So 1 month after that, like the 40% from this study average, 6 months after HIFU treatment, 92%. So 2 years after that, completely disappeared. So from their study, 25 cases. This is another study about the long-term evaluation, still from Beijing, from the affiliated Beijing Maternity Hospital of Capital Medical University. So they enrolled 51 patients. Still, they like say 1 month, 6 months, 12 months, 2 years, 3 years, and 4 years. You can say the 51 cases after HIFU treatment, over 2 years, they say the pain disappeared for these patients. So this followed up patient didn't report the pain recurrence. So now we should compare we already know that HIFU treatment is effective and safe. So can we compare this treatment with surgery? So here is a study from the first affiliate hospital of Chongqing Medical University, like 54 consecutive patients with abdominal wall endometriosis were enrolled, and 29 patients had a surgical resection, and 25 patients had a HIFU treatment. So then we can see the results, and here, like the technical success, both group had 100% technical success. About the treatment time, we can say almost similar. So HIFU treatment in their hospital, like 16 minutes average, and the surgery 56. So about some low significant difference. But in their study, the solution time is 287. So this study here is much higher than the other studies from Sweden and even from Beijing is much longer. So they compared the intraoperative bleeding, of course, low bleeding in HIFU group, but this surgery, they should have some bleeding. And also they compared other things, I think, because it doesn't, as I think we just compare the hospital stay. So after surgical resection, the hospital stay was almost 1 week. Then for HIFU in their hospital, just they stayed like the 4.4 days, and significantly shorter in HIFU group. So they also compared the cost, the cost of HIFU treatment was less in their study, but there was no significant difference. They compared, but from this table, we saw the cost was less. And about the adverse effects, they also compared. Now you can see using minor adverse events, like the HIFU group, like they had 8% had a hematuria, probably just some air bubbles in the, I think air bubbles in the bladder that caused this one. And also like the skin had some changes, five patients. But for the major adverse effects, so only like the 3 cases in the surgery, but low, like this kind of, and no major adverse effects occurred in the HIFU group. So about the effectiveness, they compared the surgery. Of course, they already removed all the lesion, so completely removed. And in the HIFU group, like 92%. Okay, 92. About the symptoms improvement, both groups achieved 100% of the symptom relief. About the long-term symptom, like the midterm symptom improvement, like they follow up for the surgical treatment, like the 29 months average, but for the HIFU group is around 25 months. So no significant difference between the 2 groups. And about the recurrence rate, no significant difference between the 2 groups. It means like the effectiveness, both groups can achieve the same rate of the effectiveness. So here is another study performed from 2009 to 2015 from the third hospital of Xiangya College of Central South University, Changsha, Hunan, China. So they enrolled 51 patients in this study. They compared HIFU and surgery. So here it's like they treated 23 cases were treated with HIFU, and 28 of the patients treated with surgery. So here still, they compare the bleeding. Of course, only surgical resection causes the bleeding, but the volume is not much. And the pain score after HIFU, immediately after HIFU, the pain score in the surgical resection group, of course, is significantly higher. And the hospital stay in their center. So the HIFU group stayed for 5 days, and the surgical resection group just stayed for 8 days. So there is a significant difference between the 2 groups. Yeah. So this is about the size changes and the pain score changes after that. So first we see the pain score changes like the 1 month after the treatment, the HIFU group just 1 point. And of course the surgery group the same. And the 2 months, 3 months, 6 months, and 12 months. And 2 groups about the same. So there was no significant difference between the pain score changes after the treatment. So about the size of that, of course, after the surgery, they have low lesion after that. But here, this they gradually shrank. So only 6 months. So there were significant differences. That makes sense. But we should see the long term, just like the previous study already showed. So here is about the summary and HIFU treatment, like as a non-invasive treatment, already show it's a promising. And I think we can use this technique to treat the abdominal wall endometriosis. So because the effectiveness of HIFU treatment is comparable with surgery, but with less adverse effects and short hospital stay. So only the problem is right now is that they study because the patient like is not so many. Okay, they like this study, the sample size was small, and also like I think if we compare with surgery, because the HIFU already showed the non-invasive and the treatment with less adverse effects and a short hospital stay. So I think the retrospective study already show the results comparable. So I think like in the future, we can perform the randomized clinical study to compare, to confirm if HIFU can reach the same results like the surgery, So that's what I want to share with you, and thank you very much.
Thank you very much, Professor Zhang Lian. So this is very interesting procedure to treat the patient. And in my opinion, I think this is the best way for me to do the procedure, because sometimes when I do the surgery for the abdominal wall endometriosis, I cannot find the lesion, right? Do the incision and use the finger to find where is the lesion, because sometimes it's very small, like 1 centimeter or 2 centimeters, and the belly, the abdominal wall of the patient is really thick. So sometimes it's very difficult to find where is the lesion. But if we use the HIFU, it's a real-time ultrasound.
Yes.
So that we can find the lesion in one time, right? In one time, and of course maybe it's use less time to reach the target. So very, very interesting. So if I have the chance, I will use it for treat this kind of the patient. That is my comment. And now we don't have the question, so we can move to the next speaker.